Hello, I'm Dr. Richard W. Fleming of the Beverly Hills Institute of Aesthetic and Reconstructive Surgery. Today we're going to talk about lips. All of us always have admired luscious lips. We've paid attention to the lips of ladies for centuries. And actually, men today also get involved in some of the lip aesthetic work that we do. However, when we talk about lips, we invariably think of Scarlett Johansson or Angelina Jolie. So it's something that we've always been interested in, but we have to give credit to Barbara Hershey in her movie Beaches back in 1988. She brought it to the world's attention that you can in fact do something to enhance one's lips. And since that day there's been a tremendous interest in our improving the appearance of one's lips. The ideal, the upper lip, is a little bit smaller than the lower lip. Scarlett is very close, but that's typical. We want nice contour. We want the skin of the upper lip to be smooth, and we want that nice pout, even in a more mature lady. There are many different things that we can do to enhance the lips, but I advise you, first of all, to make sure your surgeon's aesthetic tastes agree with yours, because there's a lot of different things that can be done, all within the realm of normal, but it amounts to personal taste. This young lady, before and after, from the side before and after, her lips were augmented. Now, for my personal taste, this is a little too full. But this is exactly what she wanted. She came back and wanted a little more, and I repeated it and augmented her lips further. She's happy. That meets my aesthetic taste, although a little bit fuller than I would ideally recommend. We want to avoid the trout lips, and unfortunately we all see too many examples of that. We've heard Lisa Rinna talk about her lips, and very publicly about her lips. She had too much put into her lips. They did not look good. She was a very pretty lady. She's a wonderful individual, but regretted the work that she had done earlier. As many of you know, in the recent past, she reduced the size of her lips back to a normal proportional beauty, and proportion really is the main criteria for beauty. The lower lip, the lower pictures here of before and after of augmenting this lady's lips, that's more within my taste, but certainly is discussed thoroughly with the patient before surgery. The lower lip is a little bit larger than the upper, a nice proportion between the upper and lower lips with a slight pout, which is very, very attractive. The material used varies. You can use fillers such as the hyaluronic acids, Juvederm, and Restylane. My first choice is fat. We have done fat liposculpture for many, many years. We're very enthusiastic about it. It's a little bit more involved than simply having the fillers injected, but the advantage of fat augmentation is their own tissue. Nobody's ever allergic to it, and the duration of the improvement is far longer than when you use fillers, which the manufacturers say last 6 to 12 months, but in our experience has been anywhere from 12 to 24 months, the duration of improvement with products such as Juvederm. The augmentation of the upper lip sometimes involves treatment of these vertical lines that occur to aging, secondary to aging. You see all the lines of her lower lip also. Using fat in this lady, we eliminated the lines, we improved the pout, the contour, and the proportion, as well as the volume of the lips, which had been lost due to aging. Men will also use this product. You see here, it's a normal male with smaller lips. We injected fat into his upper and lower lip to improve the volume, fullness of his lips. We can also, in addition to augmenting the lips to improve the pout, we can use it to improve the surrounding lines, like you see on this woman, where fat was injected here to improve that entire perioral area. It's another lady who had fillers injected here to soften those vertical lines adjacent to the mouth, which many of us see with aging, but also enhance and improve her lips. There are many choices here in terms of what is done to improve lips, whether it be an inherited characteristic or an aging of the lips where volume and structure is lost. However, with this work, be very, very careful. Look at a lot of your surgeon or physician's before and after pictures to determine whether or not his or her aesthetic tastes are in concert with yours. For more information on this topic, please go to our website, which is www.bevhills.com.
You make me feel so young. You make me feel so spring has sprung. And every time I see you grin, I'm such a happy individual. The moment that you speak,